Do you have an interest in a health profession that allows you to make a difference into the lives of others? Would you like to complete your education in 2 years after high school and be ready for employment in a career as a physical therapist assistant? My name is Dan Ashley. I'm a physical therapist and a professor in the Physical Therapist Assistant Program here at Volunteer State Community College in Gallatin, Tennessee. Licensed PTAs work under the supervision of a physical therapist to apply the treatment plan that is designed to help rehabilitate a patient. And patients of all ages from birth throughout the entire lifespan may receive physical therapy treatment. You will find PTAs working in a variety of settings that may include hospitals, extended care facilities, outpatient centers, home health care agencies, public school programs, and early intervention programs, to name the most common. What classes have you enjoyed in your education so far? If you say science, health, communications, and algebra, you may be a good candidate for this profession. PTA programs are 2-year programs that will lead to an associate's degree. At Volunteer State Community College, students must complete 1 year of prerequisite courses that will include anatomy, physiology, English, physics, and medical terminology. Some other general studies courses are also required to prepare them for the 2nd year of the program. Admission to the 2nd year of study is competitive, and not every student who may apply will be accepted into the program. Acceptance is determined by the student's grade point average from their first year of classes and other information that may include an interview with the student. Once admitted to the 2nd year of study, students are taught by licensed PTAs and PTs. Students also have 15 weeks of full-time clinical education that allows the students to work in various clinical settings under direct supervision of licensed PTAs and PTs. After graduation, students will be qualified to take a state licensure exam in order to practice as a PTA. Job opportunities for new graduates are optimistic, and an average full-time salary in Tennessee ranges from $45,000 to $50,000 per year. So enough from me. Next, we are going to observe some of our current student PTAs who are practicing patient care skills that they will be doing in their clinical education. You will see a student practicing in the role of the PTA and another student practicing in the role of the patient.
Goniometry is a vital part of PTA work. We measure joint motion to determine any deficits our patients may have and to help us decide how we can best serve our patients. If patients do have decreased range of motion, we will work with different modalities and stretches to increase the range of motion. For those who wonder if geometry has a practical use in adult life, here is a professional application where knowledge of geometry is necessary. In addition to geometry, medical terminology and anatomy and physiology will help prepare you for the Physical Therapist Assistant Program.
Ankle sprains can be some of the longest injuries to heal. They may take up to 6 weeks. Keeping our patients non-weight bearing allows for time for the sprained ligaments to heal, as do immobilizers such as wraps, splints, and casts. To be non-weight bearing, our patients must have strong muscles in the weight bearing leg. Different assistive devices can be used to ensure the non-weight bearing status, such as crutches and walkers. As PTAs, we train our patients appropriate gait patterns or how to walk with an assistive device to ensure safety and proper use of the assistive devices. The brain sends signals to our muscles to control their movement. These muscles also send signals to the brain about the position of the body. With a traumatic brain injury, these signals can be miscommunicated between the brain and the muscles. As PTAs, we play a role in the rehabilitation of these patients. Weight shifts are a simple yet effective exercise to help patients with balance and coordination. These can be performed while the patient is seated or standing, and different implements can be utilized to increase or decrease difficulty for our patients, such as balance boards, foam mats, and parallel bars.
For more information about the Physical Therapist Assistant Program, go to volstate.edu or follow the link provided on the screen.